Hello, my name is Nathan Jones and today I'll be talking about the respiratory system. What is the respiratory system? It's the organ system responsible for the gaseous exchange between the atmosphere and the blood. What is respiration? It is the exchange of oxygen and carbon dioxide that occurs in the lungs and the cells. It involves four collective processes. Pulmonary ventilation, breathing, which is the movement of air into and out of the lungs. Transportation of respiratory gases. External respiration, which is the movement of oxygen from the lungs to the blood, or carbon dioxide from blood to the lungs. Internal respiration, movement of oxygen from the blood to the tissue cells, and carbon dioxide from the cells to the blood. The muscles involved with respiration are external intercostals, which is the more superficial layer. It lifts the rib cage and increases thoracic volume to allow for inspiration. Internal intercostals, which is the deeper layer, and it aids in forced respiration. And the diaphragm, which is the most important muscle in respiration. On contraction, it enlarges the thoracic cavity, reduces the pressure in the lungs, which allows for air to rush in. The functions of the respiratory system: for the uptake of oxygen, elimination of carbon dioxide, elimination of water vapours, temperature control, and the production of sound. The respiratory system comprises of two components: the upper respiratory tract and the lower respiratory tract. The upper respiratory tract it opens passages from exterior to lung, eliminates carbon dioxide. The process involves, it goes from the nostril to the nasal cavity, to the pharynx, to the larynx, to the trachea, to the right main bronchus, to the left main bronchus, to the lungs, and then to the diaphragm. The lower respiratory tract, it has to do with the structures and passages within the lungs. So for the upper respiratory tract, it starts at the naval cavity, which ensures that the air is warm, filtered, and moistened. It then goes to the pharynx, which is the muscular tube extending from the region posterior to the nasal cavities to the esophagus. Joint use for respiration and digestion. In other words, it's a passageway for air and food. Air then goes to the larynx, which is commonly known as the voice box. It contains the vocal cords and folds. It is formed by 9 cartilages, which form the most prominent is the thyroid cartilage, also known as the Adam's apple. The larynx has 3 main functions. These include: it provides and opens airways, it acts as a control switch to manage air and food, and it assists in voice production. The air then goes to the trachea, which is commonly known as the windpipe. It is the tube extending from the larynx to the T5, which is approximately 10 to 12 centimeters long. It lies anterior to the esophagus. The trachea ends by dividing into the 2 main bronchi. It then goes to the lower respiratory tract, and the conducting zones structures of the lungs include the bronchi and the bronchiole, whilst the respiratory zone structures include the alveoli, the respiratory bronchioles, alveolar ducts, and the alveolar sacs. The bronchi, which are branching of the trachea, form the right and the left primary bronchi. The right bronchus is shorter, wider, and more vertical opposed to the left. As a result of this, it is a more common site for inhaled foreign objects to become lodged. Once inside the lungs, each main bronchus, left or right, subdivides down into 2 secondary bronchi. The left bronchus has 2 lobes, and the right bronchus has 3 lobes. Small bronchi then lead to the bronchioles. The bronchioles are often referred to as little bronchi. Passageways are smaller, less than 1 millimeter in diameter, which serve as air passageways inside of the lungs. There is no cartilage inside the wall of the bronchioles. Furthermore, they consist of elastic connective tissue, smooth muscle, and mucous membrane. Air then goes to the alveoli, which are the thin-walled air sacs. It is arranged in clusters, known as alveolar sacs, off of the central alveolar duct, surrounded by capillaries which aid the site of gas exchange and assist to performing external respiration. The lungs are comprised primarily of alveoli and respiratory pathways. Each of the lungs is surrounded by pleura. The lungs are made up of fibrous, elastic connective tissue. This allows for the lungs to recoil submissively during respiration. The pleura, there's parietal pleura, which lines the thoracic cavity, visceral pleura, which covers external lung surfaces. The pleura fluid is a lubricating solution which enables the lungs to glide easy over the thorax and wall during breathing. Any questions?
Is one side of the lungs bigger than the other?
Yes, the right side is bigger. This is due to the heart being on the left-hand side. The right-hand side has 3 lobes, whereas the left-hand side only has 2.
What is occurring in the respiratory system if someone is suffering from asthma?
Asthma is a condition that is often characterised by episodes of coughing, wheezing and tightening of the chest. These specific characteristics can be observed singularly or in conjunction with one another. It is an active inflammation of the airways, of which the muscles tighten and the lining of the airway swells. In turn, sticky mucus is produced, which cause the airways to become narrow and consequently difficulties in breathing occur.
So what's happening in the respiratory system if someone suffers from a cold or if they have allergies?
It is causing an inflammation of the nasal muca, which, in conjunction with excessive production of mucus, nasal congestion and postnatal drip. During the nasal passage, linking those to the throat, it enables there to be direct link and natural progression from a nasal cold to throat and chest.
I've recently been told that I had 2 blood clots in my lungs as a result of having surgery on my ankle. And the doctors told me that I'd developed pleurisy, as well as having a pleural infusion. What does this even mean?
Pleurisy is an inflammation of the pleura, which as previously discussed is the external lining of the lungs. When the pleura becomes inflamed, it often can result in stabbing pains with breaths, which is a result of friction from the rough lining. Furthermore, if this process progresses, it can often result in development of excess fluid. A pleural effusion is when fluid accumulates in the pleural cavity. In other words, the fluid can accumulate with either blood or flood filtrate. Thank you.